Now, live from WUSA 9, this is 9 News This Morning at 9 a.m. WUSA 9 News, the first and only local news in the nation's capital in high definition.
Well, some people spend a fortune on creams trying to get rid of varicose veins. Others load up on vitamins or use acupuncture. With us now to talk about what really works is Dr. James Laredo, a vascular surgeon at Georgetown University Hospital. His patient, Elizabeth Radmard, is also here, and they'll both be taking your phone calls in just a few minutes at 202-432-1999. So if you have any calls and you'd like to ask the doctor or Elizabeth, that's the number, 202-432-1999. But Dr. Laredo, Elizabeth, thank you both for being here with us.
Thank you.
Elizabeth, I want to start with you. When did you first notice anything about varicose veins on your body? Was it painful?
It was about 10 years ago, and no, it wasn't painful.
How severe was it?
It wasn't severe.
So what brought you to the doctor's attention? Why did you seek him out?
Because I did develop problems earlier this year with an open wound that refused to heal. I sought other medical attention, went through wound therapy for several months, 2 or 3 times a week. Unfortunately for me, it was not successful. I was then referred to Dr. Laredo.
And how do you feel now?
Wonderful.
Doctor, is that the consequence that some people could suffer for not taking care of varicose veins sooner?
Sure, absolutely. Varicose veins affect 60% of the United States population, and 20 to 50% of those folks are symptomatic. Those folks who have symptoms with varicose veins also have another condition known as venous insufficiency. And so those are 2 separate conditions. And Mrs. Radmard had varicose veins that weren't giving her symptoms. However, she had the second condition, chronic venous insufficiency, which is what led to her development of this ulcer on her leg, which after successful treatment has healed.
Has healed. She's doing well. Varicose veins, are they hereditary?
Yes, there is a hereditary component to varicose veins.
Is it mostly women who suffer? Because that's what you hear about and see on the TV commercials.
Yes, yes. The vast majority of patients with varicose veins are women, actually, and more women are affected by that. The
treatment that Elizabeth sought in the beginning, and we mentioned about the creams and the acupuncture and massage and whatever, are they all bogus, or they work for a time, but you may, in the end, have to seek something more sufficient?
Well, talking about the creams and so forth, those have not been shown to be successful in treating symptomatic varicose veins. Remember, we're talking about 2 separate conditions, symptomatic varicose veins and also venous insufficiency. And what Mrs. Radmard had was essentially one of the severe end of venous insufficiency.
So if, let's say, laser treatments, that wouldn't take care of the venous insufficiency either?
Actually, those are 2 separate conditions, the varicose veins themselves. So you can treat the varicose veins by removing them, which is called phlebectomy, or you can treat, if they're smaller, you can treat them with injection therapy, which is called sclerotherapy as well. For the smaller ones, the very, very small, fine spider veins, which fall under the category of varicose veins, you can also treat them with a cutaneous laser as well.
These are the kinds of questions that can be answered if they're yours. 202-432-1999. We'll be hearing from you in just a few minutes. Right now, an update from Kim. Winds picking up, Kim?